Imagine a hospital, a place meant for healing, becoming a breeding ground for a silent but deadly threat. That's the chilling reality of VRE, a superbug that's making headlines in New Zealand. An infectious diseases researcher reveals that this antibiotic-resistant bacteria is responsible for sickening 1 in every 10 people it encounters. But here's where it gets even more alarming. VRE has already caused 2 separate outbreaks at Christchurch Hospital, and Health New Zealand is scrambling to contain its spread. VRE, short for Vancomycin-Resistant Enterococci, is a type of bacteria that's become resistant to many antibiotics, making it incredibly challenging to treat. And this is the part most people miss. While it may not cause issues for 90% of individuals, it specifically targets those who are already sick or vulnerable, turning a routine hospital stay into a potentially life-threatening situation. The bacteria can lurk on surfaces, patient equipment, and even unwashed hands, silently spreading within healthcare settings. Health New Zealand has identified fewer than 10 patients with the infection, but the concern lies in the many asymptomatic carriers who could unknowingly transmit the bacteria. In response, they've implemented strict precautions, including screening and isolating patients who've stayed overnight at Waikato, Thames, Tauranga, or Lakes Hospital, as well as day patients in renal or oncology wards. Here's the controversial part. Associate Professor Mark Thomas from the University of Auckland points out that VRE has been present in Waikato and Bay of Plenty hospitals for years, and despite efforts, it's proven nearly impossible to eradicate. He argues that the overuse and misuse of antibiotics have fueled the rise of antibiotic-resistant bacteria like VRE. While New Zealand hospitals are generally cautious with antibiotic use, the growing prevalence of superbugs raises a critical question. Are we doing enough to combat this silent epidemic? As VRE continues to spread, the window of opportunity to eliminate it is narrowing. The challenge lies in catching it early, when numbers are still low. But with the bacteria's ability to persist in hospital environments, the task is daunting. So, here's a thought-provoking question for you. In the battle against superbugs like VRE, should we be focusing more on preventing antibiotic resistance through stricter regulations, or is it time to invest heavily in developing new treatments? Share your thoughts in the comments. This is a conversation we can't afford to ignore.